Dear ladies and gentlemen, labas vakaras, good evening. Dear colleagues of Researchers Excellence Network, it's our great pleasure to have another RENET event this evening. And it's my great pleasure to present to you that today we have an opportunity for a nice discussion about the current situation, very tense situation in the Europe, as well as in each country due to the pandemic situation. And today we have the key speaker, Professor Uroš Pinterič. It's our great pleasure to greet you, Professor, as you are having very fruitful cooperation with Researchers Excellence Network for several years. We know you perfectly because your insights always are very significant and important for the scientific community. So, Professor today will speak about perspective on politics policy mix in the context of COVID-19, the case of Slovenia. It's interesting as Professor Uroš is presenting Alexander Dubček University in Trenčin, Slovakia, but he's presenting the situation in Slovenia. Maybe later he will explain how it happened. And today this public lecture will be moderated by me, Vita Juknevičienė, and my colleague, lecturer Anželika Gumuliauskienė. So if you have any questions, do not forget that you had this opportunity to give those questions in the chat line, or just to raise your hand, and we as moderators, we will see it and we'll give you the floor to discuss with our presenter. So if nobody would like to add some hot issue, maybe we could start our public lecture. So Professor Uroš, the floor is yours. And one more technical issue, please, dear colleagues, mute your microphones till you will have the possibility to speak, as we trying to avoid any technical issues. So Professor, the floor is yours, and thank you for being here.
Thank you. Thank you, dear colleagues. Thank you, dear Professor Vita, to say so. We agreed already a couple of times that we won't be, abusing ourselves with title of professor. We know each other for quite some time, actually, and I'm always happy to join you in Šiauliai, in Lithuania, one way or another. Unfortunately, the situation as it is, and the situation about we will be speaking today, is preventing us to meet in person. But I hope that sooner or later there will be the time when we will be able to see each other again in person and share some more positive experiences that we have it currently. Thank you for the opportunity to speak to you. For sure, I wouldn't say that I have some kind of big influence, but I can agree that sure, I appreciate having the opportunity to share some thoughts on different topics. Regarding my positioning, yes, the point is that one other crisis a few years ago, the economic one, pushed me out of my home country. So that's why I work at the Alexander Dubček University in Trenčin currently, while I still live in Slovenia and I follow the situation here a bit better. Despite one thing that really happened, if we didn't believe, I don't know, 10, 20, maybe 30 years ago about the globalization, and I would dare to say that majority of us don't really remember very well the anti-globalist protests in 1999 in Italy, also in Prague, in Seattle. So now we have the situation that we cannot deny the globalization. Unfortunately, that's not the globalization of the positive economic effects or the negative ones, obviously, which are connected to it, but it's actually the globalization of the health situation. Anyway, This being said, or just being reminded that we live in the world which is extremely interconnected, as it was never before in the history, we can say that each country has to fight the situation on its own, or even in the world where we are all globalized on one hand, when it comes to the crisis, each country was fighting on its own. And even in this perspective, we can see that we didn't manage to suppress the reality or the healthcare situation, public health situation in very effective manner. And already during the first wave of this corona crisis or coronavirus spread, whatever you want to call it, probably the only term that I won't be using is the one which is, defining the origin of it, because it has nothing to do with the global situation. Anyway, we were, even in the first wave or at the beginning of the first wave, the only thing that we understood was that there will be the second wave. Yeah. So in March or in February, even in some countries, we understood already that this is not something that will go away in a very simple manner, that it will follow us, and that we need to be prepared for a bit more. Now, I promised some kind of lecture, to say so, on politics policy mix. What I'm trying to do here is first to elaborate on a few points how we as political scientists, or maybe you're coming from different fields, but yes, my background is political science, how we are ignoring when we are specializing each other or ourselves on those who are dealing with the politics and those who are dealing with the policy side of understanding the political reality. And this coronavirus situation showed us very well that response to one-time event is something that it's not only the question of policies, but it's also the question of politics, and how much the politics can influence the policies when there is a crisis decision-making process. When we have these long-term or very established systems of working in stable conditions, in many cases we can, to a certain degree, say that ignoring the daily politics is possible and the policy will be following its natural development course. But when it comes to something so sudden and so turbulent as it's, extremely infectious disease, then the policy field, it gets shut down. And one of the main issues that we are hearing in these days is actually that scientists are pushed aside, that different branches of science is pushed aside. Everybody becomes smart again. Everybody knows everything. And even me as a, political scientist, how much I can say about the public health. But on the other side, me as a person following and being affected by certain elements of this health crisis, yes, probably I have the right to speak about it. I don't have the competence, but as a citizen, I have the constitutional right to be saying something about it. And when it comes to this, that we actually execute our constitutional rights, talking about the matters of science, we are, diminishing the, we are diminishing the knowledge potential in the science. But at the same time, when we follow, and I think that most of us does follow the healthcare situation, we can see the patterns. And even if we don't really understand all the, let's say, biology or medicine behind them, we can see if the measures took the right course or not. So in this perspective, what I'm trying to do today is check how the policy, which should remain kind of knowledge-based or expertise-based decision-making, fails in the crisis situation. Because science doesn't have the time to get the final results. One of the best cases right now, we have about at least 10 different vaccines tested. And we were promised the vaccine in different time periods with different certainties. So we had all the promises from the autumn to early winter to next spring and so on and so on. But the reality on the medical expertise is most likely that there will be no stable vaccine which would be safe to use in general manner, to say, yeah, for next 5 years. Not taking into the account different virus modifications. And understanding this part means that there is no time, because in the meantime, obviously, people are getting sick, people are dying, and so on and so on. And we cannot rely solely on medical expertise in this perspective and wait what happens. We need to find another solution. So what we have here, it's actually very fast forward system of policy process. So if you studied public policies, at least a bit, you know the concept of policy process, where you have these phases when you have first identification of the problem, setting the agenda, finding the solutions, deciding what is the final solution, implementation, monitoring, and evaluation. And if we have enough time to deal to go through this process, for instance, for development of the economic system in most of cases, for especially developing our military doctrines, for developing our economic policy, and so on and so on. In this case, we don't have this precious time. So basically, daily level, we define what is our policy problem in that moment. On daily level, we decide if we're going to deal with it or not, and how we will deal with it. We are finding multiple solutions for the same problem at the same time. One is the healthcare, which is obviously primary finding the vaccine. The second one is internal security matter, which is predominantly social distancing and reduction of the human contact. Sure, we can consider it as a medical. It's medically based, but actually this is part which is enforced by the police in most of the countries. Yeah? Medical experts can say this will work, but Ministry of Internal Affairs is the one who is making sure that this functions. And if somebody is breaking the rules, obviously there is fines. I will go to this on the case of Slovenia a bit later on. At the same time, this strongly affects the economy. Businesses, not only that they cannot work normally, but at least in case of Slovenia, and I believe that it's pretty much similar all around Europe at the moment, businesses open and closed on order of the state on daily basis. So now in the second wave, for instance, in case of Slovenia, these cosmetic salons were closed on day one, whatever day one is. On day 3, they reopened by the same government because they figured out that providing the manicure and pedicure for the elderly people is the essential service. So within 3 days, it was like, you are closed down, you are reopened. And during all this period, the company which is providing this type of service doesn't know what's going to happen. If they need to fire or lay off the workers, do they need to just tell them you will have some unpaid leave, you might have paid leave, and government changes these decisions on daily basis. Also for other things, but this is maybe one of such more day-to-day cases. So we have this system of the solutions which are parallel solutions, and they're implemented as it's appropriate in the moment. But all these solutions, even if backed up by the expert opinion, they're the political solutions. Unfortunately, those political solutions don't have enough time to be reconsidered by the protectors of common sense, to say so. Who is the protector of common sense in the decision making? In most of our countries, it's obviously the national parliament, where the thing is debated, when the thing is reassessed, obviously in political perspective. But there needs to be some kind of agreement. Because we live in the crisis situation, there is no time that such reassessment, what will have positive and negative consequences, would be done in timely manner. So the government takes the sole responsibility because it's much more flexible in decision making. Sure, because of restrictive nature of these solutions, these policy solutions, if they are, because, we need to be aware of two things. One is that when I'm talking now about the policy solutions, this is not the whole policy. The whole policy, it's everything put together. I shouldn't be, or anyone else shouldn't, forget about this, that all these small elements are on one hand the policy solutions, but the policy in the whole is much bigger thing. Yeah. So the government is obviously deciding on these small things on the daily basis without the consent of the parliament. Even if the consent of the parliament would be possible because of the parliamentarian systems that most of our countries have, where there is, whoever gets the parliamentarian coalition forms the government, and obviously when they have the first yes, usually they have the peace for 4 years, yeah, because parliament just, reconfirms what the government proposes. So yes, it's losing the time, but on the other hand, from the rule of law perspective, it's rather how to say, very honestly tyrannical. Yeah. So the question of tyranny of the minority, but we are facing actually some kind of executionist state, where the government has the sole power. We know this type of decision making when the parliament functions only pro forma in the systems that we are trying to avoid, or that we were trying to escape historically from them. Yeah, so obviously in different forms, but the logic is there. There is the question of implementation. What really happens? The rules in many cases cannot be implemented because they're prepared within few actually hours in many cases, and they are prepared without understanding what is behind. None of the ministries has appropriate deep knowledge how, for instance, restaurants operate. None of the ministries has immediate knowledge how even the healthcare system operates as a whole. Nobody has a knowledge available at the moment how different stores operates, how different companies operates. So supply chains are broken. Services are not delivered. Not only that restaurants are closed, but there is so much food which needs to be thrown away, and this is actually business damage, and so on and so on. When the solutions are coming in this manner, they're obviously harming the economy and harming the society even stronger than they would in the case that we would have enough time to reconsider how to create things properly. Well, now what is happening behind all this picture is two major questions. One is the question of the security versus the freedom. And at least in Slovenia, and I would assume that in most of countries, the state decided that freedom is, how to say, relative human right, which gets abolished in different situations. And public health protection has a higher priority than has the freedom of human existence, actually. Obviously, there is also the constitutional courts, at least in some countries, including Slovenia, which agreed with the government that current situation requires the limitation of certain freedoms. However, the thing which is hidden behind this is on which level those freedoms are limited. In many cases, we can see that there is a limitation of freedom of movement, depends on the territory and depends obviously on the country preferences. To which degree? Right now, I am technically unable to leave, no, sorry, not technically, but legally unable to leave my municipality. Slovenia has 212 municipalities right now, and for me, it kind of works because I live in a rather big municipality. So, you know, between my house and the center of the municipality, there is 10 kilometers on the road. So I can at least go somewhere in this perspective. But when you have the rather small community, which is considered to be municipality, that means that practically you cannot move more than maybe 1 or 2 kilometers in each direction. So you know, there are such cases in the country. The second thing, which is kind of important behind is how much and which of those measures will remain in place and under which conditions after the health situation will calm down, and how often in the future we will be remembered or reminded of the COVID situation. I don't want to go into the discussion how significant is COVID from the healthcare perspective. In many other countries around the world, COVID is now the, let's say, among top 3 or 4 causes of death in year 2020. In Slovenia, it got to the place 5 or 6. The difference between the other countries, I was checking the data for neighboring countries and for Slovenia, the difference between neighboring countries, so Italy, yeah, this rings the bell from the spring, Italy, Austria, Hungary, Croatia, and then for some other countries like France, Germany, United States. We know how it's in the United States. In none of those countries, pneumonia and flu is among top 5 or 6 causes of death in year 2020. Yes, 2020. In Slovenia, right now, flu and pneumonia are still caused more deaths in 2020 than COVID. And at the same time, COVID is one of the most, how to say, forceful or most progressing causes of death in Slovenia at the moment. So it's peaking, but in year 2020, in Slovenia, still 100 people more up to this day, 100 people more died because of COVID than because of pneumonia and flu. So is this the same thing? No, it's not. Don't get me wrong, please. It's not that there are different types of situations. But what I'm trying to say is that in other countries, pneumonia and flu are usually below first 10 causes of death in the country. In Slovenia, this is not the case. So when you have this type of situation, obviously this brings up lots of skepticism. Also, when you see different patterns in the behavior of the government, this brings even more skepticism. And obviously, the government has more and more issues to defend its decisions. Because in the spring, we all understood that coronavirus or COVID-19 is actually something which is dangerous, something that is spreading, something that it's taking lives rather fast, something that will not go away soon. And I would say that with some exceptions, obviously, but in most of the countries, especially European countries, there was rather clear message to flatten the curve. Yeah, and everybody worked on flattening the curve. Yeah, we understood. We got the picture what it means if we are not careful. So the curve will go like this. I hope that is this the right direction, because probably the camera is the other way. But you know, the logic was don't get into this position. Yeah, with the curve. Yeah, and then we were trying to make sure, you know, that this curve goes as slow as possible and that it turns downwards. And that was very clear to everyone. And it brought the results at the price of approximately, 2 months of limited possibilities in life, which were slowly increasing again. So what happens next? We need to solve the tourist summer season in most of the countries. In case of Slovenia, this was much more obvious because we are the first neighbors of Croatia, to say so, and we are going there for the seaside. In Scandinavian countries, this is a bit less the case, and obviously people were sick of the situation, try to do something with the restarting the lives. Well, they restarted the lives and they restarted the new cycle of the coronavirus around Europe. Not only in the case of Slovenia, but we saw these patterns even earlier before in Serbia. We saw these patterns in case of Czech Republic. Italy was a bit later on, but however, after the mid-July, the numbers start to rise again. So what we did next, we promised that we will protect people. But we didn't speak about flattening the curve, even when the numbers reached the same numbers as it happened in the spring when we started the panic immediately. Yeah? So what happens in this situation? Government loses its credibility because we don't trust. First, at least in case of Slovenia, I can speak on these numbers because, you know, those I have a bit more in the head. So epidemic in Slovenia was declared in the spring when we had, I think, around 25 cases per day. And we had the epidemic declared with complete shutdown and so on. And we understood it somehow, and we were afraid of it. And for every death, we were, oh, that might spread. But this kind of situation and the government measures prevented, you know, the spread and outburst of the crisis. Now we have different situation when we have in the mid-August, 30 people per day, nobody cares. And nobody dies for a very simple reason, which is, you know, summer immunity is actually something that we usually gain. Yeah, so during the summer, less people die even in the natural circle because the weather is better, the immune system of the people survives a bit easier certain conditions, and that was the case. What happens next? 1st of September, schools open. Schools needs to function normally. The first thing that we closed in the March, in the first wave, was the schools. First, we closed the schools, and then we were thinking, you know, how we're going to close the shopping centers and so on. Now, the schools with the 1st of September are open because children are not, you know, dangerous population. But what we forget is that even if there is certain amount of cases, children will be not endangered, but they can be asymptomatic carriers, which is the case for the most of the situation. And out of this, they will come home, obviously, and they will go with their parents. They will go to their grandparents. And I will show you later, actually, how it was developing. So the virus spreads to the school system and goes back to the homes. Partially, obviously, it spreads also in the working organization, so in the business. And what happens next, obviously, mid-September, the numbers started to rise. Government still didn't react. Government didn't react actually till mid-October, when we had 1,500 new cases per day. Our top number for the first round was 61 cases per day. That was our top in the spring wave. Now we had 1,500 cases per day. When the government says, "Oh, that's not good," well, I have some interesting words for this, but they are not for the public. Yeah. And when this happens, governments slowly start to react. How far the reaction came? That we have right now the same measures as we had them in the spring, almost. At the same time, government is thinking right now to limit us not only to the municipalities, but to limit us to 1,000 meters around the place of residence. So, you know, municipality gives still some freedom in most cases, even if it's very much uncomfortable. Now we should stay within 1,000 meters away from our house. Is it necessary? We will discuss this bit later on. And the next thing that they're thinking about is that there should be fines, so the penalty, for anyone who would be judging the spread of the virus, who will be criticizing the government, or maybe especially asking to, you know, rebel or to resist to the government measures, with 1,500 up to 15,000 euros. So net average salary in Slovenia, it's right now around 1,100 euros. That's net salary, and 65% of people earn less than this. So obviously this means that government was so much misjudging the situation that now they are not only afraid of the coronavirus, but actually of the protest, as we saw it in Prague like 14 days ago. We had some provocation, I think it was last week in Slovenia. We had certain elements of violence which might be connected to something else, but you know, when you live in the tough conditions, things are triggered. So in France, there was a case, or a few of them. In Austria, in Wien, it was the situation. And actually, what happened just yesterday evening in Slovenia, there was a quadruple murder, which could happen or not. But they said that guy was not known to the police before, and he killed his whole family and himself. Would this happen otherwise? I'm not smart enough to say yes or no, but what I understand is that obviously in these conditions we are more and more getting into some kind of psychological crisis as well. The season of holidays is coming in, and what the government will do in the future, it's questionable how they will assess the situation, either to give the people the freedom for the holidays, and obviously that's going to result in next spike. That's not a question. In Slovenia, we are already talking about the third wave. So that's not something which I made up, but this is the pretty much the position of National Public Health Institute. They already started to prepare us for the third wave, which would be somewhere from January onwards. So either they open, or we open the countries for the holidays, or obviously we wait for a little bit safer situation. create more psychological damage to the people, and at the same time, after the 15th of January, we relax a bit, but it means that we will just, prolong, postpone the third wave for approximately additional month. So what I would like to do now in this discussion on how the government responds and how government assesses the situation, I would show you how the crisis developed in Slovenia through different phases, just that you have some bit better picture. I hope that it's gonna work. Let's see. I need this one. Okay, so I hope that you see something which is now my screen.
Yes, we can see.
Yes. Yeah, okay, that's good. Thank you. So this is the numbers of active cases. The numbers below, they are the daily changes. So confirmed cases, almost 50,000 so far. Active cases at the moment assessed to be over 21,000. Per day, we are approximately 1,000 cases in 14 days. In 14 days per 100 people. This is daily changeable, and yesterday it was almost 1,100. So you can see here that we have the positive change for -2% approximately. So we are lowering this number. Hospitalized in 150 new ones, 101 got dismissed from the hospital, 19 died in the hospital. Intensive care unit, and here you see 27 deaths today altogether, but 19 in the hospital, 4 in the intensive care unit. The rest of the people died at home, obviously, or in other institutions like this homes for elderly as well. So this is not in this map. So what is going on? This is how the things were happening in Slovenia in the situation. This doesn't look too bad, right? I would at least assume, that this doesn't look too bad. Well, the point is that this is the situation last 2 months. If I give you the situation for the whole period, you can see this was the spring here. Here is March 23rd. I hope that I won't show. So this was the spring wave. And this is what happened between September and now. Yeah. So that's the difference. Whatever happens in the spring, it's almost non-existing. Why it's non-existing? Very simple, because the government actually took decisive actions which made sense. And obviously, where we have the same situation like here, the spring, I cannot switch off those comments very well. But this was the last point. This was the last point where we had approximately same size of the wave as it was in the spring. This is September 13th. So after the September 13th situation, as you can see it, just got worse and worse. Yeah. So understanding that incubation period is somewhere between 2 days and 14 days approximately. Yeah. September 13 minus 14 days, we are end of August. So the holidays ended. There is the 1st September when the schools reopened. And at the same time, this is obviously the period when people came from holidays and started, massive work. So yes, people in the working unit, so in business mixed, people in schools mixed. And then you have the situation as it happens because the government decided that flattening the curve is not the motto of the day anymore. Yeah? And because they decided that we will see how long we can go on with the situation. And here is the proof how long we can go with the situation. Okay, now I change the map. This was 2 months. Now I go to for 3 months period, so that you can still see something and that I can explain the things a bit better on than on the big map. So what happens is on 22nd of August, Croatia got on the red list, despite Croatia should be in Slovenia, according to Slovenian logic, on the red list from 1st of August, or if I'm not mistaken. Yeah. So Slovenian government gave Croatia additional 14 days, approximately, of, you know, let's see what happens. And even afterwards, when Croatia got to the red list and there is strict 14 days quarantine on the return, this was with exceptions. If you are able to prove where you were staying and if you had the property there, and understand that approximately 100,000 Slovenians have the properties in Croatia, yeah, at the sea. So if you had the proper reason, you didn't need the quarantine. Yeah. So even this strict quarantine, it was not that much strict. And it was also that if you're returning back in earlier than 48 hours, you don't need to go to the quarantine. Yeah. So what this means, I can go through over the weekend, I can go to Croatia, return back, and I'm still okay. Yeah. So this strict quarantine, it's not really functioning, and it was not functioning as Europe closed the borders in the spring. Yeah? So what happens? 1st of September, all schools reopened. Why it says all schools reopened? Well, very simple, because during the spring, schools were closed down. All the education process was running through the distance learning. I'm just gonna switch the map if I'm able to see new testing method. No, we don't have it here written. Okay, I will find it somewhere else. So what happens then? September 13th, we reduce the quarantine time to 10 days. So this is like relaxation, actually. Before it was 14 days, now it's 10 days. So you have 4 more days when you can actually still, according to medical experts, kind of likely develop the symptoms and you are potentially dangerous, but they say you can run around. So what happens next? September 19, again, face mask required in all indoors public places and outside by distance less than 2 meters. What is the problem with this one? The problem is that obviously the masks became mandatory again much earlier for most frequent public places. Now, from September 19, you need the mask in the libraries, for instance. Before you needed them in the stores. The story behind this, that most people go to the store on daily basis and they don't go to the libraries on daily basis. So chance of being exposed to something is much smaller. So we had the mask mandatory in the spring wave. We had then about 2 months without the masks. So May and up to, I think, 10th of July or something like this. After 10th of July, masks were mandatory in the stores again. And did they help? Well, we see the results. All this time, the masks are mandatory. Sure, they're protecting, but they are not the measure which would be sufficient to stop this curve to pick up to this level. So what happens next? Then you have another relaxation that you can enter the country, so entering Slovenia, if you have the negative test on entry to the country, which means that obviously you go somewhere abroad, you bring, you know, I think it needs to be 48 hours fresh negative COVID test, and you can enter Slovenia without a problem. 48 hours is 2 days. But you can develop the sickness in much longer period of time. And obviously, if I don't want to deal with 10-day quarantine, I will use just, this opportunity to have negative test, which I can, in many cases, still present and then develop the sickness within a longer period of time. Cherna, this is just the question of the internal geographics. So 9th of October, we are already not only in the school year, we are now in the study year. Study year in Slovenia starts, or university year starts with 1st of October. Now we have limitation of collecting the people in the public spaces to 10 people. Otherwise, they need special permission from the National Healthcare Institute and so on. So here we start to limit the number of people who are able to gather again. Yeah? So this is 9th of October. 9th of October, and we have there where it's 21 of October, limitation of people, movement of people, approximately here. Yeah. So if this would be that much important, the numbers at this point that you can see it on the map, somewhere here around, the numbers should turn around. It was not enough. What happens next? We stopped the schooling on 19th of October so schooling in person at 19th of October for all the children which are about the 6th grade, so 6th grade and higher. That goes students which are like 12 years old or something like this. 19th, 29th, and then we have out of this approximately, let's say, 4th of November. 14 days between measure is taken and when the measure should show the results. So around 4th of November, we are here. We have the peak. Yeah. So you can see that closing the schools started to give some results. We reached the peak. Next thing is on 20th. So next day we have the police hour or curfew. Yeah. So we are not allowed, still not allowed to move outside of our residences between 21 in the evening and 6 in the morning. Does this help? I'm not sure. I cannot predict this, but how I see the numbers and the dates, I would say that there is some connection. And very shortly, let's see if here is something more. Municipalities, yes. And 27th of so 24th, so it was schools was 19, then it was 20, it was curfew. On 24th it was closure of the restaurants. So this was the package which functions, and the last one was 27th of October, which produced the limitation of people to the municipalities. And sure, 27th is kind of away already from 19th. Yeah, there is a significant difference in time, but this is the period when the measures started to have some effect. So this is some numbers on people who died. You will see this one. That one is kind of just for the perspective what is happening. Why this one is not? Oh, I need to check this one. That's the right one. So admitted to the hospitals, let's say this one. So this is the death situation in Slovenia, the difference between the spring and nowadays. This is what the government created in the second wave by not applying the strict rules immediately. Yeah. In the case of the spring, epidemics was declared on, I think, 15th of March or even day earlier, because I remember those days since we were a bit worried if everybody will come home safe. Yeah, Vita. that was the case. Yeah. So at that time, we created this situation, and all together here, in the spring wave, until the 7th of June, there was approximately 110 people who died. Yeah, and now 110 people died in less than a week. Yeah. So what we created in 3 months in the spring, because the government took the decisive action, and because they trusted that this is the only solution, and because they had the motto to flatten the curve, we prevented lots of dead people. In the second wave, there is a bit different picture. We need to understand that those numbers are obviously just from the people which were hospitalized, so the actual numbers are still a bit bigger than here, but you know, 27th on the that was pretty much a big situation. So this is now the regional display. I'm going to show you the regional display. This is then the municipalities. This is the municipality totals, absolute. So these are the absolute numbers, and obviously you see that Ljubljana was the most strongly affected. Then there was some places here around, and obviously Novo Mesto was rather affected. And just, you know, what happened here in this territory, obviously now this number is rising a lot, but this territory, it's the western coast. So what we had, especially in the spring, in this western part of Slovenia, was due to the climate, we had much better picture. Why? Because people were first outside. We had warmer climate. The difference between Ljubljana and western Slovenia, it's approximately 5-6 degrees. Yeah, we are warmer at all times. And what is happening in this territory? Here it's the economic reasons. This territory in the eastern part of Slovenia is predominantly rural, so there is much less dense population. Obviously, what this means, that in the territories of dense population, obviously the virus spreads more. This is why it affects the cities much harder, and obviously you can quite well define based on this map, or if you go for any other country, you can see what is the main problem. And obviously, COVID, in this perspective, I can say that it's the illness of urbanization, because urban territories are creating much more occasions for mixing of, let's say, unknown people. Just as a personal anecdote, despite all the measures that government took, I was in all this time rather active, and we had few cases in village where I live, but the point is that we are living in general very much apart from one another. It's not like, you know, Ljubljana has the density, I don't know, maybe 200 people per square kilometer or even more, I think. But in our territory, this density is much smaller. So even if people meet, there is no so many contacts. And before, and we get much more isolated in the first place. And that's one of the reasons why certain territories were not affected as much as some other places. Okay, this is the maps of what's going on in the municipalities right now, but this is next important thing that we need to know. First, the total testing. This was the situation. The line which is important is this one, share of the positive tests. Yeah, and in the spring, the government had maximum like 6% of the tests were positive. Now we had the peak at 34%. People were tested, people were positive. And what is the difference behind this? That actually spokesperson of the Slovenian government just 2 days ago said that we have now rather low amount of positive tests. We are talking at this point. Yeah, share of positive tests, you can see 23% approximately. That is rather low, and rather high was at, or panic high was at approximately 35%. Yeah. And this is how the government is communicating what is going on in the country. And here, when we had 3, 5, okay, 5, it was kind of peak in early September. The government was saying, oh, yeah, well, we need to be kind of careful, but nothing's going on. Government started to do the panic around here, when it was about 20% of positive tests. This was the point when the government started to panic. And actually, yes, this was the time of 17, 18 October. If you remember, on 19 of October, they changed the school regime. So the government didn't care to compare the early phase or the first wave. Government didn't care to compare the first wave with what is happening here for whatever reason. Yeah, and because of this, we have then this type of the situation. And obviously this is connected with what I was mentioning in the introduction, that when you have this situation, you don't need to be epidemiologist, you don't need to be medical doctor, you don't need to be even highly trained expert in any other field. But if you just follow the numbers, you understand that government is not sending in the same situation the same message. And obviously this reduces the amount of trust for the government. And what this means at the end of the day is that, sure, people start to question what is real and what is not real. Every death, not only in Slovenia, but anywhere in Europe, every death is very much real for the environment in which it happens. But at the same time, this becomes real also on the level of the statistics. And when the people start to follow this kind of numbers, now I have lots of different options for rationalization, for trying to cope with the situation, because it's something that we never went through. Yeah, and in order to understand it, I can either deny the existence of the danger, I can be overprotective, or I can, at the end of the day, obviously find myself protesting against the government decisions. So this here you have the redistribution of confirmed cases in the country, how it goes. So this is the redistribution of the confirmed cases. And if you would take the time perspective on this one, you would see that early September, this age range, so 5 to 14, 15 to 24, they were the most highly peaking range of the population. On the other side, that's the reality of deaths. First, you need to know here there is a note below that National Institute, which is confirming the cases, takes several weeks to confirm the number of dead by COVID. So this is, behind the schedule. But what you can see, that's the part of the reality. As I said before, every death per se, it's tragic, but 85 plus, yeah, every day is a gift, even if the person is in good health condition. Yeah, so me having the parents slowly reaching this level, I understand that maybe my next birthday, there will be one person less celebrating. Yeah, and from this perspective, these numbers are not really something that will be that, they're worrying how the government let it happen in the second wave, but from the natural process, it's something that it won't change the overall picture of what is happening in the countries. Still, as I said, it's tragic. This is the European perspective, obviously with numbers how we are importing. And if in the summer, most of our import was from Croatia, which is here right now with the 18 new cases imported from Croatia in last 14 days, with old data here. In Austria, we have 58 right now. So we are not closing the borders. I understand this on the economical level, and obviously the economy is the reason behind this. But what is happening is obviously a bit questionable what we should follow. none of our governments, I would say not only Slovenian one, but also around the Europe, as I can follow the situation, none of the governments knows what is the priority. Economic policy, development of the economic policy under the new conditions, or trying to protect the public health. And it seems that if the first wave was about protecting the health, and the second wave, it was about protecting the economy, well, there will be a very interesting message, most likely in a few weeks' time, that we didn't manage with anything. Because in the second wave, we still had, at the end of the day, shut down the country as much as possible. Only difference is that we created more deaths, which would be actually preventable. So the major question, which I would which might arise during the debate part of the lecture, and which is, I think, very important for us to understand, is who is responsible. We are the people, we are the citizens, we elect the government, but we are not the decision makers. We try to live our lives as free as possible, as convenient as possible for each of us and our opinion what is good and what is bad. But in the case of who is responsible, we are responsible when we are not obeying the rules. But if the governments don't apply the rules on time when they can react, then the government is responsible. So from this perspective, in the case that I showed you through Slovenian picture, government is not responsible for the first batch of approximately 110 dead people. That's something that happened because of the causes one way or another, but let's say that it's unlucky situation. In the second wave, with all the knowledge about how the virus functions, which we gained over the last 6 months, governments should be held accountable for allowing this situation to happen. Yeah, so that's the difference. And I see that in many cases the governments managed to prevent this. For instance, in Slovakia, they have a high spike, much higher. Obviously, also the population is doubled compared to Slovenia, but they have much bigger spread of the virus. But they are able to keep the numbers of COVID-related deaths much lower than we do. So in the comparative perspective. So what we really did, we didn't stop the life in order to protect the people's health and people's lives. We stopped the life in order to hide the destruction of the healthcare systems in many different countries. Because if we would learn something from this, we would increase, for instance, the capacities. But the story was that when the second wave hit Slovenia, we filled in the beds when the government said, "Oh, we are prepared. We have everything that we need for second wave." We hit the numbers of available beds within 14 days. And then we came from 400 beds to the position that now we need almost 1,200 beds. And we were not prepared to this. Only when we hit number 400, we were, finding new solutions. So this is something that the government didn't do in the meantime when they had the opportunity to breathe. When they had the opportunity to breathe and develop some kind of actual policy and not only the political decision on daily basis, the government went for the holidays. I'm not saying this, as a absolute true, obviously I'm exaggerating, but they didn't anticipate it, what is the worst case scenario. So because of their optimism, how the situation spreads, because of lack of whatever the reasons, we are in the situations which is hitting much harder. Slovenia, yes. Other countries, in many cases, yes. If you compare the spikes, for instance, for Italy, Italy is still not hitting, right now, it's still not hitting the same amount of death as it was in the spring, but it's approaching it. Regarding the amount of sick people, the numbers tripled in Italy in the second wave. Just, you know, in Slovenia, it's even worse, but also in Italy, numbers tripled. The same goes for Austria, and so on and so on. So we forgot to learn that if the measure works, in the unknown situation, which is repeating itself, is better to apply it immediately when you see that situation might go out of the hand than wait for the last moment. Because if we would close the economy and the schools for 14 days in early September, we would be dealing with the situation when the numbers would be around 30 or something like this, and we would be able to control it much more easily than just letting it go and decide that we will figure it out when the situation really gets bad. Okay, this is not just about the policy and politics mix anymore. This is already a bit of a personal rant at the moment. So I think that somehow it makes sense that I stop, and obviously I'm happy to take some questions, try to discuss the things with you, because it's important also to see the other perspective.
Thank you, Professor Uroš. It was great to hear you and all your significant insights about the situation in Slovenia. I would like to ask our guests of this event, our participants of this event, to make some questions for Professor. You can use the chat line. Of course, you can ask orally by raising your hand, and we will give you the floor for speaking. So be brave and use this opportunity. So, Professor, while we are waiting for our participants to give you a question, I have one question for you too. As you showed some graphs about the situation, which is getting better at recent days, as I understood, in Slovenia.
Yes.
And in this graph, in the point where the situation is getting better, there was a note that the new methodology of testing was applied. So could it be connected somehow that more tests were made for the society, more let's say cases were identified, or what do you think, how it can be explained?
I think that you mean this one, and here you have new testing methodology.
As you can see, it's here it's like new testing methodology. Yes,
you have it twice. Within 14 days you have it twice. What happened in this point? So this is, let's say, 26th of October. The new testing methodology was that the National Institute for Public Health decided that they will stop testing everyone, but they will test just those who are showing the symptoms. So before 26th of October, if somebody came to the testing place saying that doesn't feel well, or called the doctor and the doctor tell him go for the testing, you know, I don't feel well or something like this, you got the test. Yeah. And what happens here is on 26th of October, as you can see how the things spiked, started to rise up. I'm going to give you just the comparison of the total process. We are here, so you can see the spring, what happened in the spring, and where I have my pointer, this is the new testing methodology. So what happens here, there is too many positive tests, so they decided that those who are not either essential or who are not showing the symptoms of COVID directly, they don't need to be tested. They are immediately ordered to be self-isolating for 10 or 14 days. So this is one of the reasons. The second thing, then you have few days later here, again, application of new testing methodology. What happens here is actually that previous methodology was reinstalled, which means that everybody who comes with some kind of problem goes for testing. So they reversed on this is 6th of November. They reversed the testing methodology back to the one which was applicable before 26th of October. And you have, for instance, here also the new testing methodology on September 9th, which affects only children. And what was done? Children, because the number started to spike, yeah. What is how I can see how this works? New testing methodology. Yeah. So what happens here? They decided that they won't test the children anymore. Before it was everybody. So before September 7, everybody's tested. After the September 7 or 9th or something like this, the children which are younger than 10 years or something like this, they were called non-endangered group, and they were not tested. So what happens is obviously that government is trying to remove the amount of pressure on the testing teams, yeah, on the epidemiologists, but at the same time, yes, the government managed to create bit misleading information. That's the first part. However, we need to understand something. In Slovenia, we had the national survey regarding the COVID infection in early May this year. Early May 2020, Slovenia had end of the epidemic, sorry. And we had in this batch officially positive 1,500 cases approximately. And the national survey figured out that based on the numbers they got it through the obviously representative methodology and so on, there was 66,000 people infected. Actually. And the difference between 1,500 and approximately 66,000 people infected with the statistical, conditions of 5% tolerance and 95% certainty, we can now calculate how many people were actually infected until this day. Some of them possibly multiple times. Yeah. And the number to which we are actually getting based on those two data and this crossing, I don't have the mathematical expression. So this crossing account or crossing calculation, we can figure out that practically there is no one who was not infected yet. Or there is about 1 million and let's say 200,000 of Slovenians who met the virus. Not necessary with the symptoms, not necessary with anything wrong, but enough, they were exposed enough that if they would be tested in the methodology, there is decent amount of certainty that they would show the, let's say, antibodies. Is this really antibodies? Probably not. We need to understand that first, it's not my profession, and as I understand it, it's obviously not also the amount which would protect us if we would be actually significantly exposed to the virus. Yeah, but it just shows that we had some kind of tracing with the situation. So out of 2 million people, right now approximately 1,200,000 people faced the COVID already. Is this the herd immunity? No, it's not. As far as I'm following the medical side of this, it's very hard to talk about the herd immunity. It's very hard to talk even about personal immunity on the level. So medical research says that there is right now like 3 months we have some antibodies after we go through the procedure, but we have the cases, we know the cases when people picked it up like 3 weeks or 1 month after they get it first time. So it's not something that we would count on. Yeah. So from this perspective, obviously, taking care of your personal health is extremely important, especially if you have some kind of additional conditions which might worsen the situation, including the things that we live quite normally with. Yeah, so diabetes, it's a condition. Asthma, it's a condition. Being with increased body mass, so increased body mass index, it's a condition which might influence the process and the outcome. So it's not just, having heart disease, cancer, or something like this are the things that we don't even notice. Yeah. So from this perspective, obviously, being careful, it's, I would say, important advice. But yes, that's the story with the methodology. Sorry, I got into the other direction.
Thank you, Professor. And we have one question in the chat line. Cornelia is asking you, what are main problems that government encounter when trying to control the spread of COVID?
Its own incompetence. that in Slovenian case, and I would say that it shows also all around the Europe, two things. Policy priorities. In the spring, there was one policy priority, which was public health. And then obviously all the countries were, filling up the economy. And in many cases, we create so much public debt that it will take the generation to pay off. Because we didn't produce what we as a countries or what the state paid to the people, yeah, or to the businesses in order to keep people employed or out of the streets and so on. So first, it is the question of the policy priorities. In the spring, it was crisis, and it was obviously healthcare policy or public health, which was in the first place. In the summer and then now in the autumn, it was how long we can go, or how if you know the concept obviously of Russian roulette, yeah. So how you can play the Russian roulette between health and economy in order that you won't get killed. And in the spring, it was the situation, there will be just one bullet in 6-bullet chamber, yeah, and gives you 1 to 6 chance. And now we were playing on the account of the economy 4 to 2. So 4 chambers were full. And obviously that's why we have this massive wave. We were waiting past the last moment when we would be able to control the situation. Because government in each individual country has still the best, not knowledge, but overview over the informations available to them. So they are not deciding blindly, like me, who is relying on public available statistics. They have all the background information. And there was really the question, how much they can force the healthcare system without falling apart, how much they can force the economy without falling apart, and how much they can forget about the people's lives before there will be situations like it was in Prague a few weeks ago. It happened, as I told you, incident in Slovenia last Thursday, if I'm not mistaken. People are getting nervous. We are getting into the situation, that there will be holiday times. We need to understand one thing. No one in this generation has personal experience with something like this. People who were born in 1918, when there was a Spanish flu, are now 102 years old. Yeah. So how many of such people exist in the world? And second, if you are born in 1918, you don't remember anything from that time, not because of Alzheimer or something like this, but because we don't remember the first years of our lives in general. Yeah. And closest to this experience that some people still might might remember is actually the Second World War. It's completely different story. But in the perspective of psychological effect, how long it goes, that is the last time in our European history that we were so systematically through the vast region influenced that much. Yeah? And Second World War was going on for more or less, let's say, 5 years for the logic of accounting. COVID, it's not lasting even 1 year yet. And we are tired and we are fed up with it and we are confused in many different ways. So I'm not obviously comparing war with the health situation, but what I'm comparing is how extreme situations that we are not used to it affect people when they are prolonged. So people survived the Second World War. We will survive this as well. Sometimes we want to obviously do something stupid. Sometimes we want to rebel, and sometimes it's even probably justified to rebel, not necessarily by not wearing a mask or something. That's stupid, because we still need to prevent ourselves in the situation when government doesn't really know how to work. But what I see is important, especially in this academic perspective. It's not just saying they're the medical experts. I know few of them. And what happened in Slovenia between medical experts, they are fighting each other. Who is expert for what? Not just on the level of who is epidemiologist, who is the general physician, and so on, but who is mentally incapacitated, to understand the disease. And they all finished the same university. So, this is then the sadness when I need to protect myself on one hand, obviously, and at the same time, I can be, reflecting the social reality of the health situation. I cannot, discuss where and how the immunity goes, but I can discuss how the people who are there, either experts or decision makers, tell me what is going on. And one of the main butcheries in this situation is actually that public in many countries, in many cases, doesn't get the clear information which would go do something, and we're gonna go through it. Because we have political fights inside of these talks. We have uncertainties. In the spring, as I mentioned in the beginning, the main point was we all knew we need to flatten the curve. And this is the difference between the spring and now, in a way. Yeah, everything is the same. Virus, obviously, on the biological level mutated, but as such, it's still the same virus. But at that time, we had the message how to get over it. Now this message is actually denied, and it's not replaced with something which would be working. So that's the big problem, which is not health problem anymore, which is not political problem anymore, but it's actually a question of communication. It becomes everything becomes at the end of the day question of the communication, and this one was never addressed in most of our cases. And then sure, when I don't have the clear message, everybody does whatever wants. Yeah, that's part of the stories behind.
Thank you, Professor. As I don't see any more questions in the chat line and nobody has raised the hand, I would like to ask my colleague Anželika to give some final insights on this public lecture as our time is running to the end.
Thank you, first of all, for very, very interesting lecture. I just want to add that we have a bit different situation. We had elections this autumn, so we will see this the peak of the spread of the virus a little bit later, because all decisions will be made, I think, maybe next week or maybe in few weeks, few weeks. So, but what you presented was very, very interesting, especially your point of view to schools, open schools, and how what influence it make to the spread of the virus, because also we still have open schools for the small children, and about these values, economy and lives, what to choose. So, and I totally agree that no one knows what to do and how to do, and to what to like manage first, how to manage first, or to try to help economy, or to try to help hospitals, or to try to just nobody knows, and we don't know we can make any forecasts for the economy, because we don't know how many crises will be in future, how many quarantines will be in future. We don't know nothing about the future. So, and I just one more time tell you thank you for a very different information gathering together, and which make a very good point, very good example for our students also, who has a lecture of public policy, how we can analyze policy implementation. So thank you a lot, and it's very, very good example exactly for the students who have this course.
You're welcome.
Example
You're welcome.
of analysis. Thank you.
You're welcome.
Thank you, Anželika, for giving, I would say, final insights or summarizing this public lecture. So, dear Professor Uroš, it was so great to have you here with us in this interesting, I would say, really good gathering of different points to see the full view of the coronavirus influence on our society and policy making. And I would like to remind that tomorrow in the evening, 15 minutes or 9:45 in the morning, Lithuanian time, we will have another lecture of you with a very interesting topic as well. You are going to talk about policy as a victim of politics, which is really gathering us, and we feel excited about this. So, dear colleagues, dear students, dear participants of this event, I hope that this public lecture and all insights given by Professor Uroš will make you to think more about what was said, and maybe to get some ideas which kind of decisions of our policymakers we should support in the future, reacting to the unfortunately daily practice and daily situation. As Professor Uroš has mentioned, that sometimes decisions are made according to the daily basis. So despite of let's say short-term insights to the policy-making process, we hope that the long-term influence of the policy will be positive, and somehow we will manage with this COVID crisis not only locally but globally as well. So, dear Professor Uroš, thank you so much for this really interesting and informative lecture.
Thank you for having me.
Yeah, and thanks to Anželika for summarizing it, and thanks to all participants of this public lecture. We wish you to have a good, relaxing evening, and hope to meet you tomorrow in the next lecture. So see you later.
Stay healthy.
Yes, and all stay healthy. Thank you so much.
Thank you. Bye.